Good morning, everyone, and welcome to the Senator Hearing Room. It's Monday, March 16th, 2020, and it is 11:32 a.m. We're here for a special meeting to consider adoption of a resolution declaring an emergency related to COVID-19 in Marion County. Because we're in this room and given the circumstances, we thought it'd be nice to start with the Pledge of Allegiance. So if you please join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. And Katrina, if you would kick us off. And Commissioner Cameron is on the phone joining us remotely.
Yeah, good morning. Good morning. Sorry I couldn't be there, obviously.
We're happy to have you there.
All right. Good morning. Katrina Rothenberger. I'm the Public Health Division Director for Marion County Health and Human Services. So I'm just going to go through what the novel coronavirus is and how it spreads, how we test for it, severity, and health recommendations. The novel coronavirus is a new coronavirus that has not been previously identified. The virus causing coronavirus disease 2019 is not the same as the coronaviruses that commonly circulate among humans and cause mild illness like the common cold. Coronaviruses are a large family of viruses. Some cause illness in people and others only infect animals. The virus is believed to have originated in bats, but now appears to be spreading from person to person. Person-to-person transmission is probably primarily via respiratory droplets produced when an infected person coughs or sneezes, as is the case with influenza and pertussis. Currently, there is no evidence to support transmission of COVID-19 associated with food. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it and then touching their own mouth, nose, or possibly their eyes. But this is not thought to be the main way the virus spreads. There is likely very low risk of spread from food products or packaging that are shipped over a period of days or weeks at ambient, refrigerated, or frozen temperatures due to the poor survivability of these coronaviruses on surfaces. Typically, supplies used while treating an individual suspected of having coronavirus includes gowns, face shields, masks, and gloves. The current inventory of the Oregon stockpile after 1 week of filling orders now has low quantities. Any request coming to the state requesting these two items will need to be for an urgent need. Any request for face shields or procedural masks that is not for urgent need will be put on hold until additional supplies are available. Requests from non-healthcare and non-healthcare supporting agencies will be put on hold. All requests for PPE are to go through the local public health authority, then to the Oregon Health Authority for review. Additionally, sanitizing wipes and disinfectants are also in short supply. Currently, physicians are able to order a test for COVID-19 through the Oregon State Public Health Lab only if they meet certain criteria: clinical admission to an inpatient facility, evidence of viral lower respiratory infection, and tested negative for influenza. Providers may order COVID-19 testing at their discretion through commercial labs, including LabCorp and Quest Diagnostics. There are no vaccines or antiviral medications for coronavirus prevention or treatment. Older adults and people who have serious chronic medical conditions like heart disease, diabetes, and lung disease are at higher risk of getting very sick from coronavirus. Symptoms include fever, cough, and shortness of breath. Some health recommendations include avoiding travel, especially if you are over the age of 60 or at higher risk due to an underlying health issue. Washing hands for at least 20 seconds and avoiding touching your eyes, nose, and mouth. Monitor food and medications for older adults to limit trips to the stores and pharmacy. Practicing social distancing. Social distancing is a public health practice to prevent sick people from coming into close contact with healthy people. This will ultimately reduce the opportunities for disease transmission. The goal of social distancing right now is to slow down the outbreak so we can reduce the chance that folks in higher risk populations will get sick, and to reduce the burden on the healthcare system. Canceling group events and closing public spaces may seem like drastic measures, but they will ultimately help reduce the transmission of coronavirus and save lives.
Thank you, Katrina. Any questions?
No, thank you for reading that. But we've gathered to declare an emergency, and could you explain to me and others why do that now?
So we are here to talk about declaring an emergency because this virus has the potential and is already impacting lives in Marion County and has significant impact to our local economy and potential for lives lost.
Sounds convincing.
Maybe I'd add a comment or two. We have two presumed cases of COVID-19 here in Marion County, and based on phone calls I've been having with folks in the community who run our hospitals and other clinics, they're very concerned about having enough personal protective equipment and test kits if this turns into a widespread outbreak. So part of the reason why, as Katrina said, we're doing this social distancing, the governor's asked us to limit gatherings, is because we're trying to buy time for our hospitals and medical facilities to get the equipment they need if this were to become widespread. We only have about 400 beds at Salem Hospital, for instance, and there's about 350,000 people in Marion County. So you could imagine if all of us needed a hospital bed at the same time, it would overwhelm the system and we'd be in a very serious situation, similar to what we're seeing in northern Italy. So I think this emergency is necessary for us to try to get that protective equipment and get the resources we need to keep our community safe. Because this disease is here in Marion County, and it's really important that we all pull together to prevent it from spreading. So, Commissioner Cameron, did you want to add anything?
Well, yeah, Mr. Chair, thank you very much. And again, I apologize for not being able to be physically present, but we've been on the phone all morning together talking about this issue and how important it is that what we're doing right here to protect the public interest. But I do want to make people understand we are going to do everything we can to try to keep normal, as close to normal county operations as possible. We know that there are people that can go to work, such as in the building profession, etc., to do those jobs. And I think we're going to try to be really wise as we move through this together as a community. And I just appreciate you allowing me to be on the phone today and all the work that our staff is doing, hours and hours and hours. And I know we've got more phone calls with Governor and White House and all those things than anybody could ever imagine. But it's something that we all care about deeply. We care about the safety of our people first. It's safety first and last. And we're gonna take this very seriously as we are. Thank you very much for letting me be on the phone.
Thank you, Commissioner. To piggyback on that, we are keeping the county open during this time. We have a number of our departments that our community depends on us, whether it's our health department, public works, sheriff's office. The community depends on us, and so we will continue to work. We are going to adjust some of our meetings in order to properly social distance and try to limit the spread of the disease. And we're going to rely on our department heads and elected officials to determine what that means for each department. It's going to be a little bit different depending on the essential functions of each department. So if any of our employees are curious what this means, they should go to their department head, and your department head will tell you how we're going to adjust in the next couple weeks. So with that, Commissioner, if you would.
I would. Chair Wilson, I would like to make a motion that we do adopt the resolution that declares an emergency related to COVID-19 in Marion County.
And I'll second the motion.
We have a motion and a second. Is there any further discussion?
No.
Seeing none, all those in favor signify by saying aye.
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 Aye. Motion passes. Would you read the,
I'm glad to. We'll read the resolution now. It's a little bit long, but maybe it'll explain it all to everybody. In the matter of declaring a state of emergency, this matter came before the Board of Commissioners on March 16th, 2020, involving an emergency situation created by the novel coronavirus COVID-19 pandemic, which is threatening life, property, and the economy. And whereas ORS 401-305 provides authority for Marion County to act as an emergency management agency, including authority to establish policies and protocols for defining and directing responsibilities during the time of emergency. And whereas Marion County has enacted in Marion County Code Chapter 2.35 pursuant to the ordinance, to the authority granted by ORS Chapter 401 that provides for executive responsibility in times of emergency and specifically delegates authority to declare a state of emergency to the Marion County Board of Commissioners. And whereas the following conditions have resulted in the need for a state of emergency, there are currently 2 presumptive cases of novel coronavirus COVID-19 in Marion County. It is anticipated that there will be additional cases in time. Whereas the following damage to life, property, and the economy can be expected from the above conditions. Novel coronavirus COVID-19 is an emerging disease and its progress is rapidly evolving. Keeping the public informed and as safe as possible has demanded a great deal of local resources relating to contact tracing, disease investigation, community information, materials and supplies, funding, and any other resources related to the health and safety of the community are expected to be exhausted. Whereas the county is in a state of emergency and
now therefore, it is resolved that the Board of Commissioners formally declares a state of emergency for Marion County, effective on this 16th day of March 2020 at 11:30 a.m. for the purposes described above. And it's further resolved that upon this declaration, a state of emergency, the County Emergency Management Program is empowered to carry out the appropriate functions and duties identified in county ordinance during times of emergency, including but not limited to requesting assistance from the state of Oregon, and shall implement the Marion County Emergency Operations Plan. It is further resolved that the Public Health Incident Command shall take all necessary steps authorized by law to coordinate the public health response and recovery from this emergency, including but not limited to requesting assistance from the state of Oregon. And it's further resolved that emergency procurements of goods and services are authorized pursuant to ORS 279B.080, ORS 279C.335, ORS 279C.380, and Marion County Public Contracting Rules 20-0280. And it's further resolved that whenever a state of emergency has been declared to exist within Marion County, or at the request of a municipality's governing body, the Marion County Board of Commissioners is empowered to order and enforce the measures listed herein below. However, if circumstances prohibit the timely action of the Board of Commissioners, the individuals identified in the order of succession outlined in Chapter 2.35.050 of the Marion County Code may order emergency measures, provided that approval from a majority of the Board of Commissioners is sought and obtained at the first available opportunity. And it's further resolved that the following measures are necessary or may become necessary as determined by Incident Command for public health and safety, or to minimize or mitigate the effects of the emergency. Enter into mutual aid agreements, redirect funds for emergency use, and order any other measures immediately necessary for the protection of life, property, and the economy. And it is further resolved that this declaration of emergency shall be effective immediately upon signature of the Marion County Board of Commissioners and shall expire upon further order of the Board of Commissioners, dated the 16th day of March, 2020. Okay. I think that's all our business. So if there's nothing else, we're adjourned. Thank you all for being here.